Hi, it's Nancy Shenker, the geezerproofer. And as I like to say at the beginning of my shows, you have a choice at any stage in your life to be either a beezer, somebody who be relevant, be in the moment, be curious, or to be a geezer, which is somebody who's stuck, set in their ways, resistant to change, resistant to listening to opposing views. So as we get older, many of us become geezers rather than beezers. And my goal in this podcast is to encourage all of you to find that inner beezer in your life, no matter how old you are, and keep on keeping on. So today's guest is really, really terrific. It's Dr. Paul Gittens, and I'll let him introduce himself in a few minutes. But the topic is, as I like to say, the power of the penis. And we're also going to talk about vaginas, and both of those body parts go through changes as we get older, the same way they do when we're younger. And Dr. Gittens and I were talking a few minutes ago about how we need to normalize discussions around things like penises and vaginas. It was great to see there was an ad for vaginal dryness before the Super Bowl this year, and TV commercials are filled with cures for erectile dysfunction. And that is part of what we're going to be talking about today. So welcome, Dr. Gittens. If you could just introduce the audience to who you are, what you do, and your general philosophy about sexual health.
Nancy, thanks for having me. And I want to be a beezer. That's what my role in life, and that's what my goals in life is, to be a beezer. And so I'm a urologist, board certified urologist, as trained in sexual medicine. And so I have sexual medicine practices here in Philadelphia, in New York, and in Allentown, Pennsylvania. In our practices, we see men and women with any type of sexual problem that you can think of. I've probably seen them at all, you know. So for men, we treat some more of our common problems we treat for men are erectile difficulties, low libido, problems with testosterone, issues with orgasms, either premature or delayed orgasm, right? I also treat male infertility, and then on the female end, we treat issues with libido. We have a number of patients that have pain with intercourse, problems with orgasm. We have a post cancer program for women that are undergone treatments for breast cancer. There's so many things we do. And so, but any problems that like a male or a female will have in the bedroom or before they get to the bedroom when it comes to desire, then we treat it.
Cool. I was telling you, I grew up with a father who was an obstetrician and gynecologist. So I thought everybody talked about vaginas at the dinner table. You know, I had no filter. And then I obviously started school and realized that a lot of people don't talk about sex or sexual organs. And I do think there still is a little bit of a hesitance for people to talk about what's going on in the bedroom. It's starting to change, but people of my generation, people 50 and older, for a lot of them, that was taboo. It was not something that you talked about openly.
Yeah, I think in the United States, we live in two worlds. You know, I think one of the worlds is that, all right, you'll see the commercials on TV and you'll see like, ads for dryness of the dysfunction. But when it comes down to the conversation, nobody really has that conversation. I mean, there's such like a disconnect with what we see on TV and what happens in our everyday life. So those are starting and really bring it to the dinner table. Like with your experiences, you're growing up. You know, my kids, I feel bad for them because I talk about penises, vaginas all the time. And so we throw those words around and like it's nothing. But I think it's important to talk about these things when they're younger. So as they grow older, then they're more comfortable with talking about them.
Absolutely.
And talking about sex.
People have been telling me that men are starting to take Viagra and other medications much earlier than that. When in your experience, do you find men start really worrying about what I call their penis power?
So I think there's two groups of men. There are men that are trying to be proactive about sexual function, and they're always worried about their erectile function, and they want to be at kind of the top of their game. And those guys that's when we start talking about kind of preventative things like diet, exercise, which we talk about actually in both cases, but especially in those situations. There's guys that want to pump more, right? So they're pumping and getting more circulation. They're using something like the exerciser or something like that. There are some other things that we do, like core wave therapy, shockwave therapy, that we do for both preventative as well as we're doing it for treatment.
Interesting.
Guys that have the other kind of section of guys that we, and they're trying to either reverse their problem, right? Or they're just trying to get some help so they can just have sex, right? So those are the two that we see, which has changed over the years, because if I go back 10 years, most of the guys are just coming in because they need treatment, right? This whole preventative thing is something, this whole preventative movement is something that's new, that I think it's gonna grow. Actually, it's kind of biohacking the penis to get it to the point where it's functioning at its best.
Oh, interesting. And you brought up the whole notion of diet and exercise, which I think, plays a huge role in health, especially as we age. A lot of people they eat crap, they're sedentary, and they have all kinds of problems, not just sexual problems. So it really is a holistic approach to staying active and virile and healthy.
Oh, definitely. I mean, if you look at, some of the number one killers of men and women, if we exercise and we ate better, then those numbers would reduce and we stop smoking. Those are the big three things that you can do: no smoking, exercise, and eat a healthy diet. You're going to have better sexual function. You're going to be less likely to have a heart attack, right? You're going to be less likely to have diabetes. All the things that we worry about, less likely to have colon cancer. All these things are linked to what we're putting in our body and what we're kind of putting out of our body when it comes to exercise.
So let's talk specifically about men over 50. Many of them have either been widowed or divorced, and so they're kind of out of practice, and some have been in sexless marriages. So, they may have no problem when they're masturbating, but then when they are with a woman or a man, we don't judge on this show, they discover that they can't get an erection. So is there any way that you can sort of pregame if you're thinking of getting back into the sexual circus after a long drought?
Well, I think the first thing is to try to figure out, for those guys that are having some difficulty, and it's really why they're having the difficulty that we have to figure out first, because the origin of their issues with the erections could differ between, there's so many different reasons, right? So one, could it be more of adrenaline mediated? Could it be more psychological? Is that one of the reasons, right? Or is it because there's a vascular issue? Or is it because their hormones are off? Or is it because they have scarring of their penis and they have Peyronie's disease? There's so many different reasons why guys can have issues with their erection. So I think the first part is not to group everyone in the same category, but to actually individualize each individual person and say, all right, this is your reason and this is your answer. So I think that's the first thing we have to do. But you're right, 50, when you look at guys that are 50 years old, about 50% of them are going to have some erection issues, right? And so, and you're right. So a lot of them get at the point where they might have had a divorce. And then, with 50-year-old guys, they're usually dating younger women, right? So they're gonna have to come to attention a lot longer and faster than guys that are maybe dating someone in their own age. So that's a whole nother category, right? But I think the key is figuring out in that particular person what the problem is, and then kind of systematically going through a detailed history, physical, hormone exam all the other things we bring in, and then and really developing a treatment plan that's going to work for that person.
Someone told me something interesting, that they believe that one of the reasons why a lot of men these days are having sexual issues is that they just watch way too much porn. And so their whole framework of intimacy is basically their hand and some naked stranger with fake boobs on a small screen or big screen. So have you seen that at all? Is there any truth to that theory?
So there are some men that have porn-induced erectile dysfunction. So that's what we call that. And there's a number of reasons for that. But one is kind of dopamine. So dopamine is this pleasurable hormone that we make in our brain, right? And it really excites us. And so what happens is oftentimes when guys are looking solely at porn and they're doing it often, right? What happens is, they may look at like a person, two people having intercourse, and the dopamine goes up, and they look at that 10 times and the dopamine goes back down, but you want another high, right? So then you're like 2, 3, 4, 5 people. And then it just gets to the point where that dopamine level just can't get high enough, and they just don't get excited. Other reasons for porn-induced erectile dysfunction is you're also comparing yourself, or you're comparing your partner to somebody that's on the screen. So for some guys, they may say, listen, like my penis just is not large enough, right? Or I'm not lasting long enough, because the guys on screen, they last for hours, right? There's no climax or anything. They're just going. Or the woman on stage, the woman on the film is sometimes very submissive, and they're like, oh, I mentioned this to my wife, and she's like, no way, you're not putting that there, So all these things kind of get balled up and can cause some issues in the bedroom. So I can't say there's an overwhelming amount of men that I see with porn-induced erectile difficulties, but there are a number of men that have the issue.
And I realize that you're a urologist and not a therapist, but do you ever counsel your male patients on what to say and do if they are in the bedroom and all of a sudden they just can't get an erection? Is there such a thing as erection etiquette?
Yeah, when guys talk to me about it, I kind of give them, because I've treated thousands of men. Always something that we could say. I think it's different. Like if you're with your own partner, if you're with a new partner, if you're with like someone that you paid to have sex with, right? So it's gonna be, if you paid somebody to have sex with, then who cares, right? The guy just kind of whatever. If it's a partner that they've been with for a very long time, then it's really having the discussion, right? Because the communication should be there, and something's been going on and it's something I want to address. And then they usually can combat that together. It's always harder when it's a new relationship, and it's that 50-year-old guy that on the apps, and he's like, oh man, like, I'm going out on this date and I just had a problem with somebody that I just met. So that's always a little difficult, and that's a delicate situation that we help to deal with. Yeah. But in general, I'm sorry. I was
going to say, for any man who happens to be listening to this podcast, I would say as a woman, the worst thing you could do is go limp and leave, or followed very closely by blaming it on the partner. Both of which,
never do that.
Yeah, but I think that that is kind of the knee-jerk reaction, to either be so embarrassed that you just like get the hell out, which is just horrible for your partner, or to turn it around and say, well, I didn't have a problem before you. Like, that's just...
So that would be the worst thing that you could say. I think that most guys say, oh, it's the first time and I'm a little nervous. I think that's kind of the go-to.
Right. If you're a good guy, you'll say that. Or, I had a little too much to drink, or, we could probably write an entire guidebook of do's and don'ts of inability to get, not to be crude, but to get it up. And if my kids are listening, cover your ears, even though my daughters are both grown. So what are some of the latest technologies? Let's say you are a prostate cancer survivor, colon cancer survivor. I have friends who fall into both of those categories. And obviously having rounds of chemo or radiation can have an impact on sexual function. So what is the latest, greatest, newest, coolest in terms of technological solutions?
Yeah, so I'll start from it. Some of the treatments that we use are recycled, but recycled in a different way. Like we talked about kind of penile pumps. And so before, penile pumps were mostly used just to have intercourse, right? You would place your penis in a tube and it would create like a negative pressure, or you'd be like a water pump or hydro pump, and then you would be able to kind of have sex that way. So now we're using that as more of an exercise. We're using it more as, all right, just like going to the gym, we want to make sure we're getting the tissues oxygen and we're circulating, right? So that's one thing. So we're using a lot more pumps where we used it differently before. Other things that we're using are, we use something called core wave in my practice. So core wave, which is focused. It's got to be focused. Everybody talks about radio, and radio doesn't work as well, but focused low intensity shockwave therapy. And so what that does is it increases nitric oxide. It increases blood flow to the penis. In rat studies, it's actually been shown to increase stem cell formation in the penis. This is rats, but there is some translation to humans. And so we use that. We also use platelet-rich plasma, which is PRP. We use also Botox. We use that off-label, where we use that to help to relax the muscle of the penis, which helps to increase the blood flow going in, which there's a whole new kind of study on stem cells and all these other things, which really is not prime time as of yet, but there's been some pretty good, there's been a couple of articles in the urological literature on that.
Interesting. Yeah, I always thought a penis pump was like one of those things that the clowns used in the circus to like make balloon animals. I didn't know how technologically sophisticated they could be. And, I've done some research since I got to a certain age, and it's really fascinating how advanced the technology has become.
Yeah, it's changed a lot. And and so if the clowns, I get the clowns were making balloons with penises, that wouldn't be good, but
no, especially not for kids.
Not for kids. We got to make sure this is an adult. This is an adult carnival, not a child carnival. But so they've come a long way, and so we use all those, and we use them in certain orders, and it just depends. And we still use some of the older medications like the Cialis, but it depends on what are we trying to accomplish. Are we trying to accomplish this a guy that had prostate cancer? Is this a guy that is just starting to have some erection issues? Is this a person that's trying to biohack and try to prevent like erectile difficulty? So it's going to be different, but we can tailor those new medications or those new treatments with older medications and older treatments to kind of get to where we want to go.
And this is actually a really good segue because, as I got into my 50s or my late 40s, 50s, I talked to my gynecologist about preventative measures, and I got on hormone replacement relatively early on. And then as I got older, my doctor upped my dosage. And again, because I come from a medical family, this was all very normalized for me. In fact, my GYN was one of my dad's residents. So, it was all in the family.
Of course.
But I have girlfriends who just say that they don't care if their vagina dries up and falls off, that they are just done and done. But what would you recommend for women who really want to remain sexually active throughout their lives?
So that's exactly what I'm glad you made a big point of that, is like women that want to remain sexually active, because there are a group of women and men that they get to a point where they say, listen, I'm old enough. I've kind of traveled everywhere and I'm okay, right? I don't need to go anywhere. I want to stay in the house, and that's okay.
And
right?
I want to keep him in my house or her in my house. They're not going out either. They're staying put. It's
staying put. But for, I'm a big proponent of, in the right patient, of hormonal therapy. I think if you look at the studies, if you go back to the WHI studies and you look at some of the benefits, such as decreased rate of colon cancer on the estrogen only arm, it was a decreased rate of breast cancer, where nobody really talks about. Mm-hmm. There's in terms of bone health and osteoporosis, it helps with that. So there are a lot of benefits. There are increased rates of breast cancer, but it's not as much as like like what the media kind of put it out to be, portrayed it to be at the point. So I think hormonal is a big first step, because we want to start hormonal therapy when it's too late, because then we can have some other issues. So that's kind of like 10 years after menopause. So we want to make sure we're starting it early. Other things that we do a number of things, and it depends on the problem. We have, for women that are having low libido outside of hormonal therapy, there are some FDA approved medications that we use for libido. And there's some off-label things that we use for libido as well. We use some peptides for increasing libido. If it's orgasm, we're also doing a whole hormonal evaluation. We use something called femtensity, which is kind of like the core wave therapy for women. So clitoral blood flow, it increases nitric oxide to the clitoris and the clitoral body, which helps with orgasm. You know, for our patients that are maybe have some vaginal atrophy, or maybe they're patients that have gone through hormonal therapy. If so, say they had breast cancer, they're a treatment for that. So we also use the Mona Lisa laser. So the Mona Lisa laser is a fractional CO2 laser, which stimulates the mucosa of the vagina, which helps with lubrication and pain. It's off-label, but we use it solely for that purpose. So there's so many ways we can treat women, but they, as you mentioned, the first thing you mentioned is they have to want treatment.
Exactly. So when did you decide that you wanted to become a urologist?
So it must have been at the table when my mom was talking about penises and vaginas.
Was she a doctor, or she just was talking?
No, my mom was actually a nurse. She was a nurse.
She worked in the medical field. All right.
She worked in the medical field. And, you know, to be honest, when I was in medical school, I really didn't know what I wanted to do. You know, I just didn't, you know, I just love medicine. I love people. I love treating people. And when you're in medical school, you go through different rotations, and you know, I did a rotation in urology, and I just loved it, you know, and I never looked back. And then from there, during my urological training, I figured that I didn't really want to even though I was good at treating prostate cancer and all these things, it wasn't my passion. My passion was sexual medicine and infertility. So I do microsurgery still for infertility, and I help make parents out of fathers that had some difficulty with sperm counts and things like that. So
that's awesome.
It's great.
Yeah, no, it's definitely a branch of medicine. You know, I always thought that what my dad did was really noble, was bringing new life into the world. And, you know, any profession where you're really helping people stay alive and vital and changing their life and their way of thinking is, you know, doctors and teachers and nurses should all be making way more than they currently are, and worrying a lot less about litigation.
I know that, especially being an OBGYN, you have to, you know,
yep, exactly.
But you're right. I love making people better. And, you know, I'm very fortunate because the patients that I see are motivated. You know, there's some parts of medicine where patients aren't very motivated. They take the same medication every day and they see little change, where when I see patients, you know, for some patients within 2 months, they're 100% better, which is, you don't really see that in a lot of areas in medicine, unless it's, you know, maybe plastic surgery or something like that. So I love it. You know, I'm really happy with all the work that we were able to do. And
I'm a really big believer, and I'm going to go out on a limb here. And as my listeners know, I just turned 68 last Saturday. I plan to live to well over 100 and continue to be sexually active until I die, and be healthy and go out with my brain and most of my body fully intact, even though I might have 3D printed parts. But, you know, part of the key, and, you know, we hit on it in our discussion, is preventative medicine and kind of normalizing these conversations, which is why I was really excited about having this as a topic on my podcast. Because I would say the same way you've got to go to get your eyes checked before you can get your driver's license renewed, or you have to get blood work before you can get married, I think that people, when they get into their 40s, should spend a lot more time and attention on preventative care. And before a problem becomes a problem, say to a doctor or to a specialist, what are the things that I can do to remain healthy and vibrant well into my 90s or hundreds? There'll be 4 million people over 100 by 2030, and I will be one of them.
I love it. I totally agree with you. I think prevention should be the primary goal for most people, for all people. Unfortunately, it's not, right? And so I would say on the other end of that, if you are starting to have some difficulties, right? If you're a woman and you're having some vaginal dryness or some pain or some lower libido, or if you're a male and you're having some erectile difficulties or some problems with orgasm, then, time to get help is now. It's not later, right? Because it's always harder to treat somebody as they progress through whatever they're going through, whatever disease process they're going through, or whatever sexual dysfunction process they're going through. So prevention, number one, but early identification and kind of understanding yourself, your body. And if there's a change, then figure out, say, hey, listen, there's something that's not right. I want to find somebody that can help me. And I think that is also a key to add on to what you were saying as an adjunct.
And to not be ashamed, not feel like you're alone out there, because obviously if it's being advertised on the Super Bowl, then you're not the only person in America who is suffering from this challenge. I'm not even going to call it a problem because it stigmatizes it. But the same way, my grandson just lost his first tooth. It's something that just happens when you're 5 years old. And the reality is when you get into your 40s or 50s, the chances are pretty good that your vagina is going to get drier and your your penis is going to get limper. And just own it and look for the solution before it really becomes an issue. Not just a physical issue, but just also a relationship issue. Because, of course, the woman you're intimate with is going to notice if you're having problems getting an erection, or a man is going to notice if while he's having sex with a woman, she's screaming not out of desire, but out of pain. So we need to kind of normalize these conversations and just make it part of our relationship talk, not necessarily on a first date, but, once you get to that point of intimacy, to be comfortable enough with a partner that you can have these conversations.
I totally agree. I think two things. I think that you're right. If a advertiser is going to spend $10 million on a commercial, whatever the cost for the Super Bowl, then it is important and it's going to affect a lot of people, right? Nobody's spending that much money on a commercial if it's affecting one person, right? Yeah. The other thing is you mentioned, I think that you're right. I find that the conversation on any kind of sexual challenge that somebody has should happen early, right? I think that it should not the first date, obviously, but I think that if you're going into a relationship, kind of talking about sexual needs, right? One, but also talking about if there's any sexual challenges and then dealing with it with that person or saying, listen, I'm going through this right now. I'm getting treatment. I just want you to know it's going to get better. But this is where I am right now. Right. So there's no surprises and there's no blame, because the interesting thing is that with partners of men that have erectile dysfunction, if it's a female, then that partner blames themselves probably 60 to 70% of the time. Right? They think it's them, right? And so it's important to not have your partner think it's them. Let them know, this is happening to me right now, and I'm going to deal with it.
So right? No blame, no shame. And hopefully,
no shame.
Hopefully we'll live in a world one day where you'll be walking down the street, and in addition to an IV center and a tutoring center and an urgent care center, there will also be a sexual health center that people will just not be embarrassed to walk into and get the help they need at any stage of their lives.
Exactly. Well, we have sexual medicine centers now. We have my center and there's some other centers. But you're right. It's funny. My first center was I've learned. So it was on the way to Saks Fifth Avenue and in here in Philadelphia, and all the guys were like, Doc, I can't, I love seeing you, but I don't want anybody to see me coming in here.
Right, to wear the fake nose and the glasses and the hat and the...
So it's so we moved quickly, right? We had to change our location. So you're right. So we should feel comfortable about, getting help and also talking to our friends about it. Because if it's happening to you, 50% of 50-year-olds have ED. So if you're 50 years old, then 50% of your friends, right? So you got 10 friends, 5 of your friends have some sexual problem, right? Or challenge, right? And so having that conversation, say, hey, listen, like I just went to see whoever and I feel so much better. And your guy's gonna be like, really? You're having that problem? I have that problem too. And so we make it a group effort and like everyone talks about it and everybody gets better and we don't have to worry about it. We just solved the world. Like we just solved the world. That's
right. We've saved every penis and vagina on the planet. So if somebody wants to get in touch with you, if you don't mind just repeating the name of your center, if someone's in New York or Philly and they either want preventative care or they have an issue they're dealing with, how do they reach you?
Yeah, so it's once again, Dr. Paul Gittens. My center is called Rockwell Center for Sexual Medicine. We're an Instagram. Our website is Rockwell Centers with an S because we have multiple centers, rockwellcenters.com.
Well, this has been great, Dr. Gittens. I really appreciate it. And I hope all of our listeners got something out of it. And if you have any questions or any suggestions for future topics, please be sure to reach out. It's thegeezerproofer@gmail.com. And you can listen to this podcast on Apple, Spotify. You're probably listening now, so you know how to get a hold of it. But it's also on YouTube and Vimeo if you'd like to see what we look like. And in closing, remember to never give up as you get older, to remain a beezer and not a geezer, and tune in every week. We're going to have a new and interesting and often provocative topic. And if you'd like to be a guest, again, it's thegeezerproofer@gmail.com. So stay hard, stay happy, stay wet, whatever state you want to stay in, and have a great day. Peace out.